Yeah, I think that this is actually a very important point that was made in the new ELN response criteria. For the first time, we have a criteria where complete responses in leukemia are divided into an MRD negative and an MRD positive criteria. MRD means minimal residual disease, and it's actually very important and relevant in leukemia responses. We've known that in patients, even though they achieve complete remission, there is a wide variety of patients who relapse and some that do not. And for a long time, this was speculated to be because of presence of minimal residual disease, and this has now been incorporated as a guideline. There are several ways you can measure MRD. The two major ways that have been put forward is either by using a flow cytometry or by using a digital PCR or next-gen sequencing methodology. And both have their own pluses and minuses. Flow cytometry is universally available. The point is to detect small amounts of disease early on, and you can use MRD in different ways. One way is to detect it early to find out if the patients are responding in an appropriate manner, and perhaps to change treatment based on the responses, and also to identify patients who have a high chance of relapse once they are in remission and have been in remission for a while, so that you can introduce treatments or possibly a transplant when the MRD is actually detected. Next-gen sequencing is a little bit unique, or digital PCR, because it uses a particular mutation type that is present in the patient and follows it serially. There's a lot of work to be done in this because you have to identify the cutoff, what methodology, and there's actually a big consortium that is looking at this right now to come up with specific guidelines on how to measure and when to measure and what to measure MRD with. So lots of good things to come. By next year, I believe that the guidelines would be out, but there's active conversations happening right now. It's a focused effort from ELN, and there are centers from ELN and US as well who are collaborating to develop these guidelines.